Noubar Afeyan is the CEO of the Flagship Pioneering Incubator underpinning Moderna, joins me now. So let me ask you the question, because I'm confused. And I'm not sure it makes a difference whether we have a vaccine in December or January at this particular point. But when do you think, realistically, a vaccine is going to be approved for use in the general public?
Richard, thanks for having me on today. You're right in that the timing of these announcements versus when a large quantity of vaccine will be available is getting mixed up a bit in the conversation today, particularly in political season. We have said that our expectation is that in the Q1 into Q2 timeframe of 2021, we expect larger amounts of vaccines to be available from multiple sources potentially, and that will be the earliest where we expect FDA to grant an approval, a full approval. Before then, as we've all heard, there's a mechanism of emergency use authorization, which might well enable millions of doses over time to be available, but the ultimate approval process we see happening in the first to second quarter of next year.
With that in mind, I mean, the vaccine, even though they're in late stage 3 trials, to ensure that there is enough of the stuff, I imagine it's being produced even now in large quantities so that when the vaccine stage 3s are finished, it's ready to go.
Yes, I can speak on our behalf at Moderna. We have said publicly that we expect some 25 million doses to be available before the end of this year, and upwards of 500 million to perhaps 1 billion doses produced next year. In addition to us, there are several other large pharmaceutical companies producing similar quantities, and this is all due to the unprecedented investment that was made, in particular through the US government and as well other governments, in enabling production of vaccines even before we could demonstrate efficacy and safety needed to administer them, because had we waited, we would have in fact waited 2-3 years to have adequate supplies.
In terms of the humanitarian effort in places like Armenia, you've been extremely heavily involved, and I realise that obviously, you know, the vaccine as and when ready for those who are suffering cannot just be a rich country's game, as I say, for your humanitarian effort.
Indeed, I'm glad to see that across the world there are efforts of countries collaborating as well as foundations to put together a coalition that can supply to mid to lower income countries supplies, abundant supplies at affordable costs. And Moderna, as our other companies, are participating in that. And we definitely don't see this problem being resolved by only a portion of the world having access to vaccines. So indeed, this is part of it's a global pandemic. We need global solutions. I think of it as the entire humanity's immune system has to be able to record and fight back against this virus, whether it's through infection or through a vaccine. And we need to keep working till we get there.
One final thought. I am confused in understanding when the vaccine's available and those people who don't take it, either because they're anti-vaccines or whatever, does that make a difference? Or should the rest of us just turn around and say, you know, we're vaccinated, we're all right, you had your choice, you didn't do it, if you get sick, it's up to you?
It would be tough to say the latter, only because we share a common planet, we share common cities and streets and offices, and at the end of the day, we do need to be caring about everybody's health. The reality is we can't force anybody to do something they don't want to do, but that would be the same as crossing the street without looking either way, and even adjusting in which way the direction of the traffic is depending on the country. And if you see people doing that, you probably would speak up and say, look, this is a risk that you're taking over and above what is prudent. I think over time, Richard, the science, the data, the adoption of the vaccine, in this case, as has been in the past, will cause people to gain the confidence that as between facing a bit of a Russian roulette of when you can get it and how severely, versus protecting yourself vaccines have long been the most cost-effective public
Right.
health measure, and I think this will not be a different scenario here.
Sir, you and your company and Moderna are doing, unbelievable work trying to get a vaccine as fast as possible, as safely as possible. And we're grateful that you've taken time to talk to us on the programme. Thank you, sir.